Adbry, tralokinumab-ldrm injection, is a prescription medicine used to treat people 12 years of age and older with moderate to severe atopic dermatitis, eczema, that is not well controlled with prescription therapies used on the skin, topical, or who cannot use topical therapies. Adbry can be used with or without topical corticosteroids.
My name is Beth, and I've been suffering from eczema my whole life, from the time I was born until just a few years ago. I would itch in the winter when it was cold out. I would itch in the summer when it was warm. I would itch while I was driving. I would itch when I was at work. I would even itch when I was relaxing. I realized one day that it had been a long time since I was itchy. It blew my mind. I had never experienced days without itching myself bloody. No words can describe how impactful the itch relief was. This is just my experience. Everyone is different.
The most common side effects of Adbry include upper respiratory tract infections, eye and eyelid inflammation, including redness, swelling, and itching, injection site reactions, high count of a certain white blood cell, eosinophilia.
I'm very grateful and appreciative with the itch relief that I've received on Adbry.
Indication and important safety information. What is Adbry? Adbry, tralokinumab-ldrm injection, is a prescription medicine used to treat people 12 years of age and older with moderate to severe atopic dermatitis, eczema, that is not well controlled with prescription therapies used on the skin, topical, or who cannot use topical therapies. Adbry can be used with or without topical corticosteroids. It is not known if Adbry is safe and effective in children under 12 years of age. Do not use Adbry if you are allergic to tralokinumab or to any of its ingredients. What should I discuss with my healthcare provider before starting Adbry? Tell your healthcare provider about all your medical conditions, including if you have eye problems, have a parasitic helminth infection, are scheduled to receive any vaccinations. You should not receive a live vaccine if you are treated with Adbry. Are pregnant or plan to become pregnant. It is not known whether Adbry will harm your unborn baby. There is a pregnancy exposure registry for women who use Adbry during pregnancy. The purpose of this registry is to collect information about the health of you and your baby. You or your healthcare provider can get information and enroll you in this registry by calling 1-877-311-8972 or visiting mother-to-baby.org/ongoing-study/Adbry-tralokinumab/ are breastfeeding or plan to breastfeed. It is not known whether Adbry passes into your breast milk and if it can harm your baby. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. How should I use Adbry? See the detailed instructions for use that comes with Adbry for information on how to prepare and inject Adbry, and how to properly store and throw away, dispose of, used Adbry pre-filled syringes and auto-injectors. Use Adbry exactly as prescribed by your healthcare provider. Your healthcare provider will tell you how much Adbry to inject and when to inject it. Adbry comes as a single-dose pre-filled syringe with needle guard or as an auto-injector. Adbry is given as an injection under the skin, subcutaneous injection. If your healthcare provider decides that you or a caregiver can give the injections of Adbry, you or your caregiver should receive training on the right way to prepare and inject Adbry. Do not try to inject Adbry until you have been shown the right way by your healthcare provider. In children 12 years of age and older, it is recommended that Adbry be given by or under supervision of an adult. If you miss a dose, inject the missed dose as soon as possible. Then continue with your next dose at your regular scheduled time. If you inject too much Adbry than prescribed, call your healthcare provider or call Poison Helpline at 1-800-222-1222 or go to the nearest hospital emergency room right away. Your healthcare provider may prescribe other medicines to use with Adbry. Use the other prescribed medicines exactly as your healthcare provider tells you to. What are the possible side effects of Adbry? Adbry can cause serious side effects including allergic reactions, hypersensitivity, including a severe reaction known as anaphylaxis. Stop using Adbry and tell your healthcare provider or get emergency help right away if you get any of the following symptoms: breathing problems, itching, skin rash, swelling of the face, mouth, and tongue, fainting, dizziness, feeling lightheaded, low blood pressure, hives. Eye problems. Tell your healthcare provider if you have any new or worsening eye problems, including eye pain or changes in vision. The most common side effects of Adbry include upper respiratory tract infections, eye and eyelid inflammation, including redness, swelling, and itching, injection site reactions, high count of a certain white blood cell, eosinophilia. These are not all the possible side effects of Adbry. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088.